Hello friends, welcome to BMH Learning. In this video, we are going to talk about ACE enzyme. ACE stands for Angiotensin converting enzyme. ACE is a central component of the RAS, that is renin-angiotensin system, that controls blood pressure by regulating the volume of fluids in the body. So basically, the enzyme converts the hormone angiotensin 1 to the active vasoconstrictor angiotensin 2. So therefore, ACE indirectly increases blood pressure by causing blood vessels to constrict, tighten, or narrow. Because ACE leads to the formation of vasoconstrictor, ACE inhibitors are used to treat cardiovascular diseases like high blood pressure, heart failure, and also diabetic nephropathy and type 2 diabetes mellitus. Basically, the vasoconstrictor angiotensin 2 binds to the type 1 angiotensin 2 receptor called AT1. The binding between these two sets off a number of down signaling actions that result in vasoconstriction and thus increased blood pressure. Along with this, ACE is also involved in renin-kallikrein system. Here, ACE degrades bradykinin, which is a potent vasodilator. So the enzyme increases the blood pressure by both forming the vasoconstrictor and degrading the vasodilator. The ACE gene codes for two isozymes. The somatic isozyme is expressed in many tissues like lung tissues, vascular endothelial cells, epithelial kidney cells, and testicular leading cells. On the other hand, the germinal form is expressed only in sperm. Brain tissues also possess ACE enzyme. In brain, it takes part in local renin-angiotensin system and converts A-beta-4-2 to A-beta-4-0 forms of beta amyloid. The latter is less toxic than the former. ACE inhibitors can cross the blood-brain barrier and hence stop the ACE to do its function, that is, to convert A-beta-4-2 to A-beta-4-0. This may lead to the accumulation of A-beta-4-2, which is more toxic form, and thus progression of dementia. Now let's talk a little bit about its pathology. There is a test called serum ACE level test. It's a blood test that measures the levels of ACE in your blood. Why get tested, or what is the purpose of this test, or in other words we can say, why is an ACE level test performed? Doctors most often use the ACE level test to diagnose and monitor a disease called sarcoidosis, and also to help differentiate this systemic condition from other disorders causing similar symptoms. In an active case of sarcoidosis, the ACE levels are increased. Apart from this, there are conditions that may cause lower than normal ACE levels include chronic obstructive pulmonary disease, hyperthyroidism, cystic fibrosis, emphysema. Conditions that may cause higher than normal levels of ACE include cirrhosis, Gaucher's disease, psoriasis, amyloidosis, diabetes, HIV, histoplasmosis, hyperthyroidism, leprosy, lymphoma, tuberculosis. But along with an ACE level test, other tests are usually done for the confirmatory diagnosis of these diseases. This was all. Thanks for watching.